Comfort on Call.
Hello, Brad. You got a little bonus cover two there for you. I know you're a big fan.
Loved it. Your banter with Dave was fun. Today we're going to talk about...
We're going to have more fun though now.
Well, I don't know. We're going to talk about a pretty serious issue. Strokes. They occur when blood flow to a part of the brain is disrupted, causing brain cells to become damaged, sometimes die. Globally, 100 million people each year have a stroke. Results in 6.7 million deaths, and this is important because most cases are linked to risk factors that are, they call them modifiable. You could change the way you live or your diet or something like that, including managing your high blood pressure, high cholesterol, quitting smoking. Those can all help to reduce your risk of stroke. But this is interesting. So doctors have a variety of tests that they can perform to actually assess somebody's stroke. It includes metabolic and lipid panels and other blood tests, EKGs to see if the heart seems to be healthy, if might there be a blockage lurking somewhere. They can also do other types of imaging, looking for these blockages, that sort of thing. And this thing called ankle brachial index study where they measure the blood flow from your heart to your extremities. Okay, so there's a lot of things they can do, but take a look at some of these. You can see that they're probably pretty invasive.
Probably pretty expensive.
Time consuming. Okay.
This is the fun part.
Yeah. What would it be like if you could assess someone's risk of a stroke just by maybe looking them in the eye? I know, it sounds crazy. Non-invasive eye scan could predict your stroke risk, so says this study out of the UK. Now, when we talk about looking in the eye, we're talking about looking at the back of the eye, the retina, okay? And you might have had your retinas imaged before if you go to the ophthalmologist or optometrist where they dilate your pupils. Make you rest your head in that little device, and then all of a sudden...
Don't move and don't blink.
Right, big bright flash, and they're taking a picture of the back of your eye, and they're looking for any defects or abnormalities in the arteries and veins, okay? So these type of photographs are called fundus photographs, okay? So what they did in this study, they utilized the fundus images from nearly 70,000 biobank participants. Do you remember what that biobank is, Chris? It's in the UK where they track patients for decades, some of them, and they're volunteers. Every year they have to go in for multiple tests and everything, so they keep a record of their health and then compare it to any diseases that or deaths that pop up to try to find some correlations. So they use that and AI.
Your two favorite letters.
So they use that together along with looking for, they call them 30 indicators across 5 categories of that retinal vascular architecture. In other words, all of those veins and arteries that they could see, they looked at them for density, twistedness, branching angles, and complexity, okay? So they had that data set, and then they matched it with some of the characteristics of those individuals, okay? Background demographics, socioeconomic factors, lifestyle, health parameters, blood pressure, cholesterol, body mass index. So they had the whole profile, okay? So then what they did is they had the AI draw some correlations. And this is what's interesting. They say that the vascular fingerprint, in other words, what it looks like on the back of that eye in the retina, can predict stroke risk with the same accuracy as traditional methods, but without requiring the invasive lab tests and the costly lab tests. In fact, that's the way they said this could really excel just in your primary healthcare provider's office or in low resource settings where just get a little, or maybe your eye doctor would share the information with your doctor. They say now, again, this needs some further testing and more work by AI, more training, but you know, if it's true, if they can replicate these results, they're really onto something, and it's remarkable. Who would have ever thought?
Yeah, game changer, and identifying, that's the biggest key right there. All right, Brad, thanks so much. Told you it was going to be fun. Still to come.